We're talking today about a unique concept in the management of cancer. And I have the authors of a great article from Nature Reviews, The Evolutionary Dynamics of Carcinogenesis and Why Targeted Therapy Does Not Work. Doctors Bob, introduce yourselves
Robert
and talk to
Gillies,
us.
Robert Gatenby.
Hi.
So tell us about, why doesn't targeted therapy work? Because now this is the silver bullet that we all have been waiting for. We have all these wonderful drugs that say we can target the androgen receptor and all these other things, and they're going to give us extended survival, but yet you don't believe that's the case.
Well, Virgil, the concept of targeted therapy is you can identify a particular molecule that cancer is expressing and that it's dependent upon for its survival, and you're able to treat it with a drug that will inhibit that molecule. And while we've been able to show that drugs can be developed against specific molecules that are present in cancers, the reality is that cancers are not homogeneous, and not all the cells are expressing that molecule. So within any given tumor, there are going to be cells that don't have that molecule or don't have that target and are not dependent upon it for survival. And what you end up doing with the targeted therapy is selecting for those cells, these other cells, to grow out. And most often what we see is that these other cells are resistant to drugs in general, and they're they're very, very difficult to kill. We call them chemo-resistant, and you end up with a chemo-resistant tumor. So I think that the problem is in the concept of visualizing tumors as well-mixed, homogeneous systems, and they're not. We know they're not.